Gather equipment, check medication order against the original physician's order according to the agency policy. Clarify any inconsistencies, check the patient chart for allergies. Know the action, special nursing considerations, safe doses ranges, purpose of administration, and the adverse effect of the medication to be administered. Consider the appropriateness of medication for the patient. Then perform hand hygiene. Move the medication cart to the outside of the patient room or prepare for medication in the medication area. Unlock the medication cart or drawer. Enter the passcode and scan employee identification if required. Prepare medication for one patient at a time. Read the MAR or the medication administration record and select the proper medication from the patient's medication drawer or unit stock. Compare the label with MAR. Check the expiration date and perform calculations if necessary. Scan the barcode on the package if required. When all medications for one patient have been prepared, recheck the label with MAR before taking them to the patient. Replace any multi-dose container in the patient container or unit stock. Lock the medication cart before leaving it. Transport medications to the patient bedside carefully and keep the medication in the site at all times. Ensure that the patients receive the medication at the correct time. Identify the patient using 3 methods and compare information with the MAR. First, check the name and identification number on the patient identification band. Second, ask the patient to state his or her name. Then third, if the patient cannot identify him or herself, verify the patient identification with the staff member who knows the patient for the second source. Then complete necessary assessment before administering medication. Check allergy bracelet or ask patient about allergies. Explain the purpose and the action of each medication to the patient. Perform hand hygiene and put on gloves. Provide patient with paper tissues and ask patient to blow his or her nose. Have patient sit up with head tilted well back. If patient is lying down, tilt head back over a pillow. Draw sufficient solution into a dropper for both ears. Do not return excess solution to a stock bottle. Ask the patient to breathe through the mouth. Hold the tip of the nose and place the dropper just above the nares about 1/3 of an inch. Instill prescribed number of drops in one nares and then into one other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching the nares with the dropper. Have the patient remain in position with head tilted back for a few minutes. Then remove gloves and perform hand hygiene. Assist the patient to a comfortable position. Evaluate patient response to the procedure and medication. Document the procedure in the patient's chart.